Breath.
Chapter 9, calculation of oral liquid doses. We'll skip past the terms and definitions because we'll cover them in the chapter. If you're already comfortable with the subject matter, perform this pre-test to test your knowledge. If not, work through the chapter and return to this for extra practice. Oral liquid formulations include solutions, tinctures, elixirs, suspensions, and syrups. Oral medications given in liquid form are absorbed more quickly than solids that have to dissolve before absorption. Most oral medications are absorbed in the small intestine, although some are absorbed beginning in the mouth or stomach. For some patients, solid medications such as tablets and capsules are difficult to swallow, and the physician will order oral liquid formulations. This is most common with children and elderly patients. These preparations are stated in weight per unit of volume, such as milligrams per milliliter. Most liquid medications are dosed in household or metric units, with metric being preferred. As with solid medications, conversions may be accomplished by either ratio and proportion or dimensional analysis. So remember, we will just be following the ratio and proportion. Some medications for oral administration are supplied in a powder form for reconstitution to a liquid form before dispensing. Liquid medications may be administered with oral syringes that are available in 1 ml, 3 ml, 5 ml, 6 ml, and 10 ml sizes. A medication cup, a dropper that is available in different measurements and is usually tailored by the manufacturer for a specific drug. Dose spoons, or by using household devices such as teaspoons and tablespoons, which is not recommended. So we have figure 9.1, a typical oral syringe. 9.2 is a typical medication cup. 9.3 are typical medication droppers. 9.4, a typical dose spoon. And then when measuring oral liquid medications using a medicine cup, read the line of the medication to the meniscus eye level. The meniscus is the curved line that develops when a liquid is poured into a container and should be measured at the lowest point. For medications that must be more accurately measured, an oral syringe should be used. With the 1 ml and 3 ml oral syringes, the dose is measured using 0.1 milliliter increments. With the 5 ml, 6 ml, and 10 ml oral syringes, the calibrations are in 0.2 milliliter increments. Liquid drug preparations are labeled with the weight of the drug per unit of volume. Most are expressed in metric units as milligrams per milliliter. Occasionally, you'll still see per teaspoon or per tablespoon on a manufacturer's label. Even more rare is the use of the apothecary system. Most labels using grains will include the metric measurement as well. Volume is usually the unknown value when calculating oral liquid medication doses and dosages. Remember, the dose is the amount of medication to be administered at a specific given time, whereas dosage is the total amount of medication that will be dispensed and administered over a particular length of time. A physician can order amoxicillin 500 milligram TID for 7 days for a patient who requests a liquid dosage form. So you would have to do the calculations, which we are going to do right now in example 9.1. Okay, so example 9.1, a physician orders amoxicillin oral suspension, 500 milligrams TID for 7 days. The medication available is amoxicillin 250 milligrams per 5 ml. How many ml are needed for one dose? So one dose meaning every time they take it, not for the entire 7 days. So we have the stock strength here. 250 milligrams over 5 ml. I'm going to put that in one side of a proportion, which means I need milligrams here and milliliters here. Our question is asking us how many ml. So that's going to be our X. And the physician wants us to give them 500 milligrams. So we're going to cross multiply and divide. So we have 250 times X, and then we have 500 times 5. So what we want to do first is find the how much 500 times 5 is, which is 2,500. And then we want to carry this with us, and then we want to get rid of that 250 because we want to have X alone. So I'm going to divide that here. So now I just have X. Then I have to do it to this side as well. So 2,500 divided by 250 gives me that X is equal to 10 ml. So that's how much they need per dose. Okay, so 9.2, a physician orders Ceptin oral suspension 200 milligrams every 12 hours for 10 days. The medication on hand is cefuroxamine 125 milligrams per 5 ml. What volume should be given per dose? So just like the other one, I'm going to take the strength of the medication, 125 milligrams over 5 ml. Then I know I need milligrams here and milliliters here. They're looking for volume, so that's going to be milliliters, so that's my X. And we need 200 milligrams. So we'll do 125X is equal to 200 times 5. So first we need to take care of that 200 times 5. And that is 1,000. And we have 125X is equal to 1,000. Now we want to get X alone. So to do that, we need to divide each side by 125. So here we get 100, get rid of that 125 and we just have X. And then we need to divide 1,000 by 125 as well. And that is going to give us 8 ml. So they need 8 ml per dose. Examples 9.3 and 9.4 are the same exact problem that we did in 9.1 to 9.2. That is using dimensional analysis, which of course we do not do. If you want to do it or if that's how you learn, go right ahead. You can look through these problems if you need to, but we teach you the ratio and proportion way, not dimensional analysis. Medications that are unstable in liquid form for extended periods of time are manufactured in a powdered or lyophilized form that needs to be reconstituted before administration. Reconstitution is the process of dissolving the powdered medication, the solute, with the appropriate liquid diluent, the solvent. Follow the reconstitution instructions on medication labels exactly to prepare the correct strength. Before use, the dry medication must be completely dissolved or suspended into the liquid form. The most important step in reconstituting a powder is to read the label or package insert carefully because it provides the directions for reconstitution. The label states the total quantity of the drug in the container, the volume and type of diluent to use for reconstitution, and the final strength of the medication after reconstitution. The label also includes information on stability and storage needs for reconstitution or after reconstitution. These directions must be read carefully and followed exactly each time a medication is reconstituted. So just a little tech note, and this is such a big help. Tap the bottle of medication to be reconstituted to loosen any medication that may be attached to the side of the container or the bottom before adding any diluent. So that's definitely something you want to do. More oral liquid antibiotics are supplied in powder form. Most are manufactured in bottles that are larger than the final medication volume to allow space for shaking before administration. Because the usual vehicle for reconstitution of oral medication is distilled water, graduates are used to measure the quantity of liquid to be added. The diluent should be added in increments according to the label, shaking after each addition. In some pharmacies, a computerized dispenser for distilled water is available. So figure 9.7 shows examples of graduated cylinders. The label on every medication to be reconstituted provides the necessary information for the volume of diluent to be mixed with the powder to provide the desired dosage per unit of volume. When medications are supplied in dry powder or crystalline form, the space occupied by the powder is known as the powder volume. The powder actually displaces or takes the place of some of the liquid needed to achieve the correct total volume. For example, a powder medication for oral suspension may only require 78 milliliters of diluent to be added to produce a total of 100 ml of suspension. The powder displaces or takes the place of the other 22 ml. The total liquid volume of the medication will be that of the amount of powder medication displacement plus the amount of added liquid. So figure 9.8 shows a graduated cylinder with 7.8 milliliters of diluent. The product manufacturers have already calculated the powder volume or displacement value for medications, and the appropriate amount of diluent to add is listed on every bottle of medication. With medications supplied as reconstitutable powders, the manufacturer's container usually provides the volume needed for a normal course of therapy. For example, most oral antibiotic suspensions will provide enough medication for the necessary 7 to 10 day supply required. Sometimes a drug normally intended for pediatric use will be prescribed for an adult, and more than one bottle of the selected liquid medication may be needed to fill an entire prescription for the desired length of time. This will be covered in Chapter 13. Before reconstitution, these medications are labeled with an expiration date from the manufacturer. Once the pharmacy reconstitutes the medication, that expiration date is no longer valid since these medications begin to degrade. The pharmacy must then assign a beyond use date or BUD according to the directions on the manufacturer's label regarding stability. The BUD should be clearly visible on the prescription label. All right, let's do example 9.5.
Okay, so example 9.5, we have a medication label for a reconstituted antibiotic, erythromycin ethyl succinate. So it says, according to the directions for preparation, the bottle of erythromycin will contain a total volume of 200 ml after reconstitution with 140 ml of distilled water. It must then be kept refrigerated and any unused portion discarded after 10 days. The expiration date of 3/22 must be replaced with the BUD of 10 days from the time of reconstitution. The strength will be 200 milligrams per 5 ml, which it says right here. So the powder volume calculation, so there's 200 ml minus the 140 ml of water. So 200 ml minus 140 ml water means that the powder volume is 60 ml. Example 9.6, we have another medication label for penicillin V potassium for oral solution. And it says, what is the total volume of medication after reconstitution? So here it says 100 ml. What volume or what diluent is indicated to be added to powder for reconstitution? So it says add 61 ml of water. And what volume of diluent is added to the powder? 61 ml. What is the powder volume? So we have the 100 ml that the bottle is minus the 61 ml. So we now have 39 ml for powder volume. And then we have the metric strength of the solution, which is 125 milligrams per 5 ml. The medication strength in units, which it tells you on here. Volume of medication necessary to provide 125 milligrams. Well, it's 125 milligrams per 5 ml. And what volume of medication would be given for 62.5 milligrams? So remember, the strength of the medication is 125 milligrams per ml. And we want to give the patient 62.5 milligrams over X ml. We want to match up our units directly across. So 125x is equal to 62.5 times 5. So of course we want to take care of that multiplication first. 62.5 times 5 is 312.5. And we want to get X alone, so we need to get rid of that 125. Cross that out, we get X loan on this side. Then we also must divide this side by 125. And that is going to be 2.5 ml.
The same methods for calculation, ratio and proportion, and dimensional analysis are used for oral, solid, and liquid dosing calculations. Liquid medications are dispensed using the measurements for liquid in the three systems: metric, household, and rarely apothecary. Conversions for the correct volume of medication depend on the measurement system to be used for administration. The household system is often used for home delivery of oral medications when a more accurate utensil for administration is not provided. The metric system is used in inpatient settings. Reconstitution is necessary when a medication is unstable in a liquid form. Most oral antibiotic liquid medications come in powders that require reconstitution with a diluent. Distilled water or purified water are the usual dilutants used. Always follow the reconstitution directions printed on the medication label exactly to attain the correct strength.